And this year, the PC-PCC will present 2 new awards that recognize leadership in the area of primary care in the patient-centered medical home. The Patient-Centered Medical Home Practice Award recognizes exemplary medical home practice committed to primary care that is patient-centered, comprehensive, coordinated, accessible, and committed to quality and safety. The Southeast Texas Medical Homes Associates, led by Dr. James Holley, the founder of SETMA and the Chief Executive Officer today, has gone above and beyond to make medical homes a reality for all of their patients and family.
So our awardee tonight is Larry Holley, and I will tell you a lot about him, and then I will tell you about how I know him, which he is a founder and chief executive officer of the Southeast Texas Medical Associates, and always the leader. In 1998, when EHRs were coming out, he got on the bandwagon and started to implement. And when he implemented those EHRs, he does not go halfway. So there are so many numerous awards from HIMSS, awards from Stories of Success, EHI. I know you are a best practice group associated with Robert Wood Johnson. And because everything's bigger in Texas, Dr. Holley also, his organization has achieved, and the only organization in the country to achieve multiple recognitions from multiple organizations around patient-centered medical home. I think that is worth some. So not only NCQA PCMH Level 3, but also AAAHC, URAC, and the Joint Commission. Four people. And probably how I got to know him the best is his incredible writing. He has been writing an ongoing article about creating a healthy healthcare delivery system. It says in here, I think it's been for almost 15 years, and I probably saw the first article around 2008, and that's how I got to know him. And I emailed him, Julie from Colorado, emailed him and I said, can I share this? It was such a powerful message of leadership, transforming primary care. It had all the elements of being patient and family centered and how to organize care delivery. And then the next thing he would do is write about the systems and structures that they were putting in place. So Julie from Colorado emails him and says, you're doing some fantastic work, can I see it? And what does he do? He opens up his website and he says, here's our link, you can have anything. We are open, we are transparent, we will share everything. And I think that's such a model for this work, the collaborative work, the collaborative nature. And so on behalf of PC-PCC, I'm pleased to present Dr. Holley and the Southeast Texas Medical Associates with the PC-PCC's first Patient-Centered Medical Home Practice Award for the exceptional dedication to achieving the triple aim, the focus on integrating the state-of-art health technology across all the sites as a means for transforming care delivery, and for teaching all of us what they have learned along the journey, openly and transparently and collaboratively.
This is very precious. I'm going to protect it for him for just a few minutes.
Thank you very much. You're very kind, and I'm honored to be here. That honor brings to mind several things. One is the first chapter title in a book I'm writing on the developmental history of SETMA. In my previous career, I did a master's degree in history and was going to do a PhD in history before I fell upon the evil times and became a doctor. The developmental history is not a chronological history, but it's an attempt to describe what has taken place for us to do the things that we've done. Before there was an EMR, before there was electronic patient management, before there was clinical decision support, before there was patient-centered medical home, before there was disease management tools and public reporting by provider name, there was a team. And we discovered that the foundational principle of transforming healthcare is to respect and honor and appreciate one another regardless of what our academic background is. And we have attempted to integrate that team in a significant way to create a continuity of care, collaborative and collegial. We don't use terms like physician extender and for nurse practitioners. We use terms like colleague and healthcare provider. And my wife's sitting here. Her healthcare provider is a nurse practitioner. Mine is too. They just happen to be the smartest people in our practice. Other than developmental history and a team concept, it also brings to mind the wisdom of a friend of mine who told me once. He said, flattery must be corrected. When somebody says that you're very bright or you're very pretty or you're very handsome or you're very strong, rather than becoming arrogant or prideful, we say, I thank you for that compliment, but I didn't do anything to get those things. God gave them to me, or my parents gave them to me. And we don't let flattery turn our head because it can change who we are and what we are. Secondly, he said, when you're praised, you need to deflect that. There are many people that contribute to our lives. Our parents, our families, my wife of 49 years, 3 months and 4 days and 11 hours.
I bet he figured that
Even my children, my teachers, and my medical school, which is the University of Texas Health Science Center in San Antonio. Dr. Hen, who's the chair of the department that I have the pleasure of serving on the adjunct faculty, colleagues and partners. These are the people that contribute to what we are, and they deserve a great deal of the praise, a great deal of the satisfaction of knowing what we've been able to deliver. They're also visionaries, that is, people that have a unique passion, such as Dr. Paul Grundy, who trots the globe. I think he uses Santa Claus's sleigh to do all the stuff he does. There are many others I could mention as well, but I mentioned Paul because he is the genius behind PC-PCC originally. And it was his vision. And visionaries are people that have a vision, but they also have a very effective way of looking at current reality. And the difference between your reality and your vision is that creative tension that makes you get up early in the morning, work hard all day, fall into bed exhausted at night, and you just can't wait to get up the next morning. I get up early, but I would get up earlier if I didn't have a wife laying there saying, you put one foot on the floor and you are a dead man. So I spend more time in the bed simply because she won't let me get up as early as I want to get up, but it's a great partnership. So the wisdom of sharing the praise is so critical. Because yesterday was Veterans Day and my wife and I spent a good part of the day in Arlington National Cemetery. I remember the lesson about sharing your praise and also being worthy of the praise that is directed your way. Do you remember the movie about Saving Private Ryan? Do you remember the most poignant part of that movie? My wife and I visited the American Cemetery in Normandy. It was breathtaking to see the marbled stones saying, "Here lies a comrade in arms, known but to God." If that doesn't take your breath away, I don't know what does. But when Private Ryan, 40 years after D-Day, visited the grave of Captain Cooper. That's not his name, but I've forgotten his. But Captain, he stood before his tombstone. He looked at it. His knees gave way, and he crumpled to the ground, pleading with his wife, "Tell me that I've been a good man. Tell me that I lived a life worthy of the sacrifice that gave me a chance to have a life, the man who gave his life that I might have a long life." There are many people that have given their professional lives, their intellect, their emotions, their brilliance. Many people have given their compassion and their hope and their trust. Many people have given their encouragement, have given their handshake or their hug around the neck to allow me to do the things I've done. I have the great honor of having been a physician, and there's no greater honor in my judgment on the earth. I love what we've done. I love what PC-PCC has given us the roadmap for doing. I'm grateful for this award, and I receive it for all those legions of people that should be here tonight, lined up around this place 16 or 17 times in order to recognize the value of what they've done. Universal American's crew here, and I would embarrass myself by trying to name all of them, but the people that I've worked with for 19 years to provide excellent care to the poorest and the neediest people in our community. The others who've come to visit with us today, Dr. Han, who's a professor at San Antonio, I thank you. I'm grateful. I wish I had a funny story to tell you, but this occasion just seems too solemn to me to be humorous. I can tell you that we received this honor with gratitude, not with arrogance or pride, but with humility and gratitude. And out of gratitude comes diligence, discipline, and determination to continue to do what we're doing, to do it better next year than we've done it this year, and the next year after that to do it better. And until I draw my last breath upon this earth, I shall press forward. For if I do not, there will be a still small voice right behind me, and the voice of our good friend sitting right down here, who will say, Larry, get up and do it more. Thank you, and God bless you. I appreciate it.